Good morning.
First thing, we decided to list out all the current problems, issues, and concerns that we each observe in the healthcare systems. And then we cluster it by actors, so healthcare professionals as well as patients. And we cluster it by theme as well, so information issues, logistics issues, and user experience issues. We decided to focus on the information theme and from the patient's perspective. So I decided to create a health literacy platform that is user-friendly and easy to use, that provides personalized information to improve patients' autonomy. Then from there, we decided what is our target population. So what's the age, what's the typical patient, as well as what information do we need, what's the data that we need to gather, what is the expected benefits from this platform, and what would that platform look like.
I'm going to walk you through the development of our storyboard, which is basically a sort of a narrative of imagining one patient's experience and the sort of use case that they would experience for the app we've built, and how it can perhaps have an impact on their lives. So the first picture there was our sort of drawn out storyboard. We then sort of formalized it with some cartoons generated through DALL-E. And I'm just going to walk you through the sort of narrative of our main character here, Gareth. So Gareth is a 49-year-old teacher with 2 kids. He's very stressed by his work and his family life, and he smokes 2 cigarettes a day, in large part due to the stress. Until now, he thought he was living a very relatively healthy life. However, he's just been surprised to be diagnosed with hypertension and pre-diabetes by his GP. He's currently feeling a bit overwhelmed, as his GP has just rattled off a very long shopping list of lifestyle changes he needs to make, and he doesn't quite know where to start. And he understands the sort of importance of making changes, but is feeling a bit overwhelmed by all the options and all the things he's been told to do. So at home, Gareth starts searching the web for information on how to manage his medical conditions. He comes across our application called Benjamin Button. He signs up for the app and imports his socio-demographic, medical, and lifestyle information into the application. From this, he receives a health status report that lists various risk factors and how they will interact with his conditions and the medications his GP has prescribed him. And the app then lists various interventions that he could take, mostly around lifestyle interventions, and explains a personalized and quantified risk reduction metric for each lifestyle intervention, which then helps effectively triage the different interventions. As part of this metric, he gets something we're going to refer to as a vibe age, which gives a sort of a modified age of his health status. So, for example, if he's relatively unhealthy, he would get a higher age, and if he makes interventions that make him healthier, he will get a lower age. Using the information from the application, Gareth is able to weigh up the lifestyle interventions that will fit best into his current lifestyle and meet his personal priorities, and he can do this in a sort of quantifiable and comparative manner. Gareth is then empowered to take actions on the interventions, and he's able to choose based on what will have the most impact and the best alignment to his own personal priorities. It makes him more able to stick to the interventions and makes his lifestyle changes more sustainable. 3 months later, Gareth is able to repeat his assessment. He is rewarded and motivated by a quantified reduction in his vibe age. He is then able to prioritize his lifestyle, his next lifestyle modifications. This way, Gareth is able to iteratively make changes that improve his health without feeling overwhelmed about where to start and without feeling demotivated about a lack of clarity on what benefit the interventions will carry for him personally.
We prioritize our customers' trust and aim for them to depend on our service. To achieve this, we plan to develop a reliable AI model, and our concept involves implementing a pre-trained health model, and we are planning to also integrate a large language model to ensure user interactions are really friendly and seamless. For the data, our plan is to get the data set from Cerner provider so that we can train our health model. So the flow is when a user will come for the first time, or whenever they have the health record, they will get an opportunity to upload that. And then from health, data is going to flow from health model to LLM to output and to the user really. And if they're coming for the second time and not really uploading any data, just to interaction, question, answer, or lifestyle changes information they need, they can come here and the interaction is going to be directly from user to LLM and then to the user. So our thought process is to provide a trustworthy AI for our user.
Welcome to Benjamin Button, and here we have the splash screen, and there will be an option for users to either sign in or create an account. So we'll skip over the account creation part, but basically in the onboarding process, they will have a chance to read the user agreement of the app. They will have a chance to read the privacy policy in terms of how the data is being processed, the nature of the model, and how that data will be stored as well. Users will have the option to upload their medical history documents, so their medication lists, any exported EMR records, etc. So once all that is done, the app takes the form of almost like a conversational AI chatbot interface to just make it a bit easier for users to interact with it by allowing them to just carry out a natural conversation with the agent, as opposed to having to type in very specific words. So here the chatbot would start asking the user for their name, and just as a safeguarding measure, just reminding them that this is not a medical diagnosis, and it starts asking about some demographic information, risk, lifestyle risk factor information that the user can input. So say age here, alcohol, smoking, exercise, comorbidities, and because the user has already uploaded their medical records, it makes a note of that as well. And based off all that, through the model, it generates what we call a vibe age. So this is what the model shows your physiological sort of wellness health age actually is. So our user was 49 years old, and because of their medical history and their risk factors, they are given an assigned vibe age of 58. And it says, based off the information that's been given, these are the top 3 ranked incremental lifestyle improvements that can be done to improve this headline age. So the key thing about the app is that the solutions are incremental. So we're not asking someone to go from smoking 10 cigarettes a day to nothing overnight. So these are incremental adjustments, and they are ranked in terms of impact on that headline age, and also it's quantifiable. So it quantifies the impact that these lifestyle changes can have on that person's overall health. And then after that, the results are automatically saved into the app as well, so that at the next quarterly checkup, the user can be able to compare how they are tracking and how they are going.